Pregnancy and childbirth are one of nature's most powerful events. Childbirth is what has brought each and every one of us life. But for too many mothers and too many babies in Nigeria, it also brings death. Around 5,000 babies die every week, babies who shouldn't die. The tragedy is huge in human terms. Roughly half the babies born in our rural areas will die either before, during, or after childbirth. And mothers in rural areas are 12 times more likely to die during childbirth than the average for the rest of the world. And for every mother who dies, 30 will have long-term health problems after childbirth. The reasons are many: not receiving antenatal care, poor hygiene during childbirth, lack of professional help during childbirth, and harmful cultural practices. But something can be done to help here. Something must be done. It's a big task, but one that the National Primary Healthcare Development Agency has taken on and is treating very seriously. They have now set up the Midwives Service Scheme, or MSS for short.
The Midwives Service Scheme is an initiative of the federal government of Nigeria, funded by the Debt Relief Funds through the Federal Ministry of Health and National Primary Healthcare Development Agency, and aiming to provide qualified health workers, in this case midwives, at frontline health facilities to help deliver women safely, and to also provide basic services as part of the effort to reducing maternal mortality in this country.
The MSS targets are clear. By 2015, the MSS aims to improve the proportion of deliveries attended to by skilled birth attendants from 36% to 72%. To reduce maternal mortality from 800 to 250 per 100,000 births. To reduce the death rate of infants during the first 28 days of life, also called neonatal mortality, from 48 per 1,000 live births to 18 by 2015.
For us in Nigeria today, it's unacceptable that we're having 800 out of 100,000 women dying giving birth. It's a rate that the government is extremely concerned about. The new health policy is addressing. Strategies at the state level in engaging the key community players are being rolled out. For us in the MDG office, it is of course one of the most important goals, the maternal health goal number 5. So some of our interventions have included the support of this scheme. This scheme is one of the biggest interventions that we've had that has directly addressed one of the major causes of our women dying in childbirth, and that is the lack of provision of professional health workers where it matters most.
One of the greatest deficiencies in our health system is the availability of human resources for health. As an intervention, the federal government of Nigeria has decided to place qualified midwives in all our rural areas to demonstrate to the other levels of government in Nigeria, state and local government, that by doing this, we can indeed, in a very short period of time, reduce maternal and infant mortality.
That I think this initiative of the midwifery service scheme is a commendable effort, and we urge all concerned to give them necessary support toward achieving this goal of, first and foremost, meeting the Millennium Development Goal, because we will meet the Millennium Development Goal 4 and 5 with this initiative, because health workforce is very vital for this achievement. And second,
MSS will seek to recruit newly qualified or retired midwives to volunteer 1 year of their lives towards this cause. They will be paid for this year and trained to ensure that they have the right skills and equipment to offer emergency, obstetric and neonatal care. To date, up to 3,000 midwives have been recruited and will be assigned to 625 primary health care centers around the country.
I am part of this wonderful scheme. For me, it is not about the money. I am doing it because I have a big passion for this, a passion to make a difference and help save lives of women and children during childbirth.
So it's those midwives that we want to bring together and mobilize to areas of greatest need. And where are the areas of greatest need? That is in the rural areas, because most of these areas are underserved. So what we do, we mobilize midwives, retired, unemployed, voluntarily into this service. We mobilize them, we train them, and we deploy them to health centers.
Those who join our MSS squad will work in twos, never alone, in our rural areas, going into the villages and marketplaces where they will meet with traditional birth attendants, train them in the need for hygiene during childbirth and emergency procedures, explaining how they can work safely together with the local health centers or clinics. They will also try to persuade pregnant women to visit the local clinics first to check that all is going well with the pregnancy, and when the time comes, to have their babies in the safety of their local clinic or hospital. Members of the MSS squad will have the joy of seeing the mothers they have persuaded coming into the clinic for advice during pregnancy. And when the time comes to have their babies, the MSS squad members will work together with the midwives on the permanent staff. Here, in the safety of the clinic, the mother can get the help she needs, which can be especially important should a life-threatening problem arise that could be too difficult for a traditional birth attendant at home, but which can be safely and effectively dealt with in the clinic. Thanks to the MSS squad, another family can celebrate new life and not a tragedy. And the hope is that with every safe birth in the clinics and rural hospitals, there will be another mother to tell the world of the help she received from the Midwives Service Scheme and how well it has worked compared to the old and dangerous ways of doing things.
And I want to take the opportunity to appeal to all our pregnant women to please use this opportunity to come to clinics, get antenatal care, be delivered by skilled attendants, make sure they do follow up after delivery, and ensure that their children have the care post-delivery so that we can save them.